Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today we will be seeing about the genetic counseling and a role of a nurse. So this is a continuation of a previous video, that is genetic assessment. So I have already uploaded the video of genetic assessment. So kindly go through that and also pin in the description box. So today we will see about in detail regarding the genetic counseling. So why we have to do genetic counseling, and do we perform this genetic counseling for all the patients? No, exactly not. So moreover, the couples will come for a genetic counseling or the genetic assessment once they have a first baby who is delivered with the genetic abnormalities or any chromosomal abnormalities. And also sometimes if we are doing the history collections from the couples and we come to know, we have a query that there is a chance or there is a probability of the baby who is being born may have any genetic problems or genetic abnormalities or chromosomal abnormalities. Maybe by assessing their history collections, like if they are being married to a consanguinity marriage, first degree consanguineous marriage, or already they have any babies with any genetic abnormalities, we perform this genetic counseling. So we'll see in detail. Definition: it is a communication process which deals with the problem associated with the occurrence and reoccurrence of the genetic disorders in a family. So for whom and all we do this genetic counseling is known and suspected hereditary disease, birth defect in the previous children, unexplained mental retardation, dysmorphism or multiple malformation in a children. Next, consanguinity, that is the marriage being taking place in the relatives. Exposure to a tetragen during a pregnancy. Identification of malformation by ultrasonography during the pregnancy. So during this period of time, by this asking the health history collections or by checking the predisposing factors or risk factors, we will do this genetic counseling. So mostly the couple will come for genetic counseling once they have a baby with any birth defect or any mental retardation, or baby is born with any abnormalities. So we do this genetic counseling in both ways, that is retrospective and prospective. So prevention is always a better than cure. So before occurrence of any genetic abnormalities also we can do the genetic counseling, and by giving the genetic counseling it will aid the couples or the person to think about the or foresee about the future, and they can take the decisions, and also they can cope up with their anxieties or fears or lack of knowledges. These all can be fulfilled by giving the genetic counseling. So the essentials of counseling is: one is detailed family history. So we are going to collect during the genetic counseling, we are going to collect the detailed family history, whether they have any communicable disease or non-communicable disease, any hereditary disease is present or not, like that we will ask every history collections from the person. Next is constructing a family pedigree. So by collecting the history collections, we will construct a family pedigree for 3 generations. So for both the couples from mother side and father side, we will construct a pedigree chart for at least 3 generations, so that we can know that what is the probability of any disease that is going to occur for their offspring. Next is, while performing the genetic counseling, we have to provide a calm and conducive environment. So once we provide a conducive environment only, they will feel very comfortable, they will reveal all the informations, and they will not have any fear or anxiety due to the environment. Next is, as a genetic counseling, we as a counselor, we must be a good communication skill. So we must be a good communicator and good listener. Next is previous health record. So while doing the genetic counseling, we should also assess their previous health record. Do they have any previously any disease was there, any signs and symptoms was there, and during their previous pregnancy how the signs and symptom was, and when did they identify the baby is having any genetic abnormalities, like that every previous health records has to be assessed. Next is maintain truth and confidentiality. So as a healthcare professionals, and that too as a nurses, when a patient is revealing their informations to us, we must have we must provide a truth, and also we must keep up the confidentiality of all the informations that is being given by the patients or the couples. So we must not reveal any information to any other persons in the healthcare setups, or even everywhere we should not reveal any information about the patient to anyone. So once we provide a trusting relationship only, they will have a confidence, and also they will think that okay, whatever the information I'm giving them, it will be kept confidential, it will not be revealed to any person. So in a genetic counseling, we must be a good communicator, good listener, providing a good calm and conducive environment to ventilate whatever the feelings they are having. If they are crying, we have to give some time, and we should not hurry up in getting all the information from them. Next is types of genetic counseling. One is prospective, that is true prevention of disease, to identify the heterozygous individuals by screening procedure. So if heterozygous marriage can be prevented or reduced. So we are saying no, like we give the education to the every family members or the communities regarding the consanguinity marriage, so that further complications in the babies who is being born to them can be reduced. So prospective means before any occurrence of any abnormalities, we are going to give the preventive counseling. So before marriage counseling and all, we will give that is known as the prospective type of genetic counseling. So this can be prevented. So we can prevent the couples who is going to have a consanguinity marriage. We can prevent the baby who is being born to that couple may have some genetic abnormalities. It is not that they will definitely have, they may have. There is a chance of having the babies with any abnormalities related to chromosomes or genetic. So for example, thalassemia or any kind of disorders or Down syndrome, anything. So we can prevent that. So in that way, we can give the genetic counseling. So before occurrence of marriage also, we can give them counseling. Next is retrospective. So mostly we can see that the couples will come to the genetic counseling once they have the baby who is being born to them have any genetic abnormalities or any chromosomal abnormalities. For example, they are identifying the baby is having any congenital anomalies or mental retardation, something. So once they come to know that they are baby is having this problem, then only they come for the genetic counseling. So what measures I have to take, what are the rehabilitative measures I have to take, like that they will come it. So what are the steps in genetic counseling? First is history collection. So we will collect all the history regarding the birth history, family history, socio-economic history and everything. Whether the mother during her pregnancy underwent any exposure to radiations or any over-the-counter medications, like that we can ask the complete history collection. Next is estimation of the risk. We will identify what is the probability of the risk they will have for the subsequent pregnancy, everything. So next is major ethical principles is, so this is a common one is autonomy, beneficence, justice and veracity. So autonomy means once we are giving the genetic counseling, they will only take we as a counselor, we will only give them the suggestions and all the counseling. So the couples will only take the decisions regarding the future terms. Next is beneficence. So whatever we are going to do on the persons on genetic counseling, it should benefit to them. So it is not like we should not just only give the counseling and leave it. Whatever we are giving to them, we have to provide a complete information. That means it should be benefited to the persons who are seeking the genetic counseling from the counselor. Next is justice, and next is veracity. So whatever we are telling, that should be in a truthful manner. Next is psychosocial aspect of genetic counseling. So once they are coming to know that their baby who is being born, that baby is having any genetic abnormalities, initially they will have a shock and they will deny it. No, how can it be possible? It is not at all there. My baby is not having any problems. Like that, they will first have initially shock and they will deny it. Next is they will have subsequent anger and guilt. They think that, so whether it is being due to fault of mine, like that means the couples will think whether it is due to the fault of mine, did I do any mistake, that's why my baby is like this, like that they will see. Next, still anxiety and depression. They will go into the depression state and they will become very anxious about why it has been occurred to my babies, like that. Next is at the last stage is they will accept and adjust it. So okay, everything has happened, now we have to adjust to the whatever the baby is having. We have to make the baby to have their survival and rehabilitation. Next is ethical guidance, that is parental autonomy. We have to give the chance for the parents to take the decisions regarding the welfare of the babies. Next is whatever the counseling we are giving, it should be a non-directive counseling. So once it is a non-directive counseling means, that means the couples will only take all the decisions related to the babies. Next is prenatal diagnosis we have to undergo. If it is going to be a prospective genetic counseling, we have to tell them what are the diagnostic procedures are there, what are diagnosis we can do to prevent, and we can identify the any abnormalities as early as possible. Next is informed and final decisions, medical genetics and termination of pregnancy. If at all during the pregnancy period, if they have come for after the genetic assessment, once they are coming for the genetic counseling, we can give them they will take the decisions regarding whether they have to continue the pregnancy or medically they have to terminate it. So we have to give the hands for them to do whatever the decisions they are taking it. Next is we have seen the ethical principles, like autonomy, beneficence, veracity, and justice, and even non-maleficence. This all ethical principle has to be carried out during the genetic counseling. So this is the main ethical guidance we have to undergo to prevent the ethical issues in the process of genetic counseling. So we have to provide all the information. So if it is going to be a prospective genetic counseling, we have to give the proper diagnostic procedures. If it is going to be a retrospective, we have to teach them how we have to make the child to live their own life like that. So this is about the ethical guidance of the genetic counseling. Next is role of nurse, that is role of a pediatric nurse in the genetic counseling. So once they are coming for after the genetic assessment or they are coming for the genetic counseling and all, we can recognize or suspect genetic disorders by their physical characteristics. Some of the genetic abnormalities can be visualized by the inspection itself. So we can have a query that so this baby may have this kind of, by seeing the signs and symptoms we can identify it. Next is create a genetic pedigree. So if they are we are going to collect the information regarding the 3 degrees of generations of the family history, so that we will come to know so what is the probability of the babies who is being born for their couples, what abnormalities they will have. Next is identify the patient family who need further genetic evaluations and counseling. We are going to give them or make them to participate in the genetic assessment and management and everything. These all are the simple roles of the pediatric nurse in genetic counseling. That's all about genetic counseling. This is a continuation video of the genetic assessment. So kindly like it, share it and subscribe it, and thank you for watching.